you, everybody, for being here today. Good to see you. No COVID news from me today, but it is the 8th anniversary of the SR 530 landslide near Oso. So I just wanted to offer a few thoughts about that day, the community response, and our efforts over the following years to really support job growth and the economy out in the Snohomish Valley. So we just talked 8 years ago, we just saw terrible devastation and death. It was just hard to fathom and hard to imagine. First going out there, the debris and the depth and the personal effects and gasoline, diesel fumes, and you look over across the river valley at this hillside, seemed like a long way away, which was a mile. You could not fathom how that event happened and traveled so far. But we really saw, along with the death of 43 people, we saw really the determination and resilience of the community and our county. That resilience really meant we could count on the community to, along SR 530 there, to come together to work to ensure that recovery could reach as many people as possible. So we realized that along with the county responsibilities, but our partners in the private sector, our state and federal representatives, we all came to the realization we really had to do more to support our rural communities that were impacted by the slide and other places. So one of the strategies includes now currently ensuring the Stille Valley is as wired as possible. You know, Darrington was cut off for many days and even weeks with very poor communication, and it really brought forward the vulnerability of that community. And we've seen that again during the pandemic with different levels of access to broadband. So we've focused lately on getting that valley connected, and the state's providing a grant for us to extend broadband to literally thousands of homes and businesses all the way from Arlington to Darrington. So very excited about that. We've also been working since the slide on the Darrington Wood Innovation Center, and really thanks to Forterra, support from the state, and hard work of Mayor Rankin and some members of my team, we're going to be breaking ground soon on that innovation center. It's going to provide jobs and also provide pretty an amazing efficient cross-laminate timber product in building materials that is used in many places of the world, but it's using materials that from our forests that we had not used. It's supporting a community in the resource base that they have out there, and so we're really excited about that. And that's coming up. It's been one of our efforts to really grow the resilience. And we're going to continue to support farmers and ranchers and other agricultural producers out there in the valley. So we're also are planning to inaugurate a memorial near the site of the Oso slide in order to give focus to those lost in the slide, the community, and really the many thousands who came to help us. So we had a tragedy 8 years ago, but really the hard work of the community and our response meant that we were better prepared for the COVID-19 pandemic. When it hit in 2020, we forged many relationships and partnerships during that response to the SR 530 slide, and those served us well in COVID. I said this before, but I'm extremely proud of how our counties responded, and I think we've built on past experiences such as the slide to help us be both prepared and know how to work together, forge those partnerships. And we're going to continue to do the same after the pandemic to really focus on the recovery of our county. And I'm just very comfortable that we're going to recover extremely well, and we are going to keep the well-being of our entire county and all our communities and all the people within the county in our sites and focus on that. And I'm sure we're going to be successful. So with that, I'm going to hand it over to Dr. Spitters.
All right. Well, thanks so much, Executive Summers, and good afternoon, everyone. Thanks for joining us at this afternoon time slot this time around. And I wasn't involved in general public health in Snohomish County at the time of the landslide, but I had many colleagues in the program I was working in at the time go and join the effort there. And at that time, the health district was a peripheral participant, but involved in that, and I think it has provided a great foundation for different agencies working together to respond to an emergency. Then it was the landslide, now it's COVID, and I'm grateful to be working in a county where all the agencies can team up like that to address needs. Speaking of COVID, the good news continues to come. Cases declined further through our last time post of Saturday, March 19. That week showed 290 cases, another approximately, I think, 40% reduction from the prior week. And the 2-week rate ending March 19 was just 79 cases per 100,000. I believe that's the lowest rate we've seen since last June or July. The testing positivity rate through the health district sites fell below 5% for the first time since December of 2021. So all good news, and I won't go into detail, but all the other settings, hospitalizations are down, cases in long-term care facilities, cases and outbreaks in school settings, everything's, going in the right direction. So that's just been great. And it's now been 11 days since the statewide mask rules were downgraded, and masks are no longer required in most public spaces, but remain optional and encouraged for those whose health or personal preference merits them continuing to wear them in public indoor spaces. It's still too early to draw conclusions about the impact that the change in the mask usage may be having on COVID transmission in Snohomish County. And obviously we'll continue to watch the data and share any signals of concern should they arise. As I've stated before, I encourage anyone who's not up to date on COVID vaccinations, anyone who's immunocompromised, and anyone who just feels more comfortable still wearing a mask indoors to continue doing that. It's also a good idea to keep a mask handy when you are out in the community. There are locations where masks are still required due to state requirements, federal requirements, or possibly at the discretion of the business or enterprise you are entering. Some of the key locations to remember are public transportation, vehicles and hubs, medical settings, and those medical settings include not only traditional, hospitals, clinics, but remember dental care, pharmacies, or the nurse's office at school or in your workplace. There may be a need to resume more universal masking in the future due to new waves of infections or the emergence of a new variant of the virus, and we'll certainly keep you aware of those recommendations if and when the time comes. On the topic of variants, you may have seen or heard news about the Ba2 Sub-Variant of Omicron. This is a descendant of the current Omicron strain that most recently went through the community, and national data show increasing proportions of genotyped specimens being this Ba2 type, now about 25% nationwide and in the Pacific Northwest region. Washington state data show 9% of genotype specimens were Ba2 for the week ending March 5, but that time frame is a week or two behind the national time frame, showing the 25% figure. So I'm pretty sure we're at a similar level. We anticipate that Ba2 will become the dominant strain, displacing the parent Omicron strain over the next several weeks. What that holds in terms of our future remains uncertain. In some parts of the world, in Europe, several countries have had a surge in cases due to Ba2, and in others not so. So we'll just have to see where that goes. The good news about Ba2 is we don't seem to see any increase escape from immunity acquired from vaccination or prior infection, and no strong signal of increased severity or need for hospitalization. So those are all good news. Though some experts do expect an increase in cases due to Ba2 in the coming months, the extent is likely in our setting to be buffered by widespread immunity due to vaccination or prior Omicron infection. But again, I can't quantify the degree of protection or what exactly we might anticipate in terms of the size of a wave related to BA2. So we'll stay tuned and let you know as time passes. Obviously, we'll not only be watching our own data, but looking at what other communities in the country and world are experiencing with this strain. Again, I just want to reinforce vaccination and booster recommendations because data clearly show that protection against variants becomes stronger and wider, meaning you get a higher antibody level that'll last you months into the future and a broader range of variants that that your body will respond to with that third dose. So if you haven't gotten vaccinated at all, or if you haven't gotten your booster dose yet, please consider doing so. I'd like to shift gears from COVID for a couple of minutes to touch on another topic, important one. Earlier today, the results of the 2021 Washington State Healthy Youth Survey were released. More than 15,000 students in grades 6, 8, 10, and 12 took the survey in Snohomish County this past fall. The survey is one of a number of tools that we use in public health to learn about what is going well and what can be improved upon for the health of youth in our community. There's some good news from the latest survey. Reports of substance use are much lower than recent years among grades 8, 10, and 12. Roughly 50% fewer students said they had recently smoked cigarettes, drank alcohol, or used marijuana. Most of those responses, even up through grade 12, were at or below 10%, much lower for the younger grades, and those proportions were roughly half or less what was reported during the last survey in 2018. A smaller proportion of students' living arrangements were due to their families' inability to afford housing compared with previous rounds of the survey, and fewer students reported the need to skip meals due to lack of money. There were also fewer student reports of engaging in physical fights over the last year. There are some areas of concern, though. One of these is youth mental health, which is certainly not a new concern, not unique to Snohomish County, and has been highlighted by the COVID-19 pandemic and the social and educational consequences of it. About the same proportion of students as in the past have reported suicidal ideation, that is the thinking about killing themselves, and there was a slight increase in reports of experiencing depression. More students are spending 3 or more hours a day on screen time unrelated to their schoolwork, such as watching TV, streaming videos, or playing computer or video games. We also see impacts from the COVID-19 pandemic in these results. One of the negative impacts was students, particularly in the younger grades, 6th grade, reporting a degree of anxiety and worry about COVID-related economic security and stress upon their family. This typically would include worry about parents losing their job or their family being unable to afford housing or other necessities. There's still a lot of information from this survey to review. Fact sheets for Snohomish County are being released topic by topic over time in the coming weeks. Some will be available on the website later today or tomorrow, and more will be added in coming weeks as they are completed. I do want to urge caution in identifying trends by comparing this survey to last year, to the last round in 2018 or prior rounds on even numbered years prior to 2018. While the trends and results are informative and helpful, there's some apples and oranges here in that over time we've traditionally surveyed the same set of kids every 2 years. With COVID, we missed the 2020 round and did it in 2021. So it's a different set of kids. Probably the big picture is not much different due to that, but we should be careful about over interpreting small changes. Also, it's worth noting that in the light of the past 2 years, the students have been living in notably different circumstances than the students who took the survey back in 2018. A number of the changes we see in the data may indeed reflect impacts of the pandemic. Students' experiences were shaped by factors like remote learning, being home more often, changes in activities and events, and programs that were introduced or expanded during the pandemic, such as free or reduced price lunches. Future healthy use surveys may give us a better handle on potential trends, as well as better visibility on the impacts of the COVID-19 pandemic. So with that, I'll hand it back to you, Executive Summers, for questions.
Great, thank you, Doctor. Any questions today? Just type them into the chat, please. Okay, first, I feel like I've heard some mixed signals about BA2. When did it become clear to officials that BA2 would become dominant?
Well, I can only speak for myself, in that I would say in the last week, you know, I've been watching it from the variant reports that come out from the state health department, showing, you know, it was 2%, then 3%, then 5%, then 9%. So, you know, you see an increase. The absolute numbers have been relatively small because although it's an increasing proportion, it's a declining overall number of cases. So, you know, it still remains to be determined, but the sense is that increasing proportion, it's going to displace Omicron, in part maybe because Omicron's kind of run its course. And we'll just have to see again, you know, the increasing proportion is an interesting fact. The impact will be if we see, you know, significant increases in numbers of cases over the coming weeks and months, and we'll stay tuned for that. But I think it was looming out there in the past month or two, but it looks like in the past week or two that it's kind of accelerating that proportional share.
Any other questions? Okay, for Dr. Spitters, you talked about this, but the IHME projects continued COVID declines into the summer, even with BA2 growing in spread in the US. Now, UW Virology says it's seeing BA2 in about 25% of cases. It's genotypes with the potential of another wave in late spring. How would you clarify that sort of mixed message?
Well, I think, you know, reasonable and informed minds can differ about, especially about the future. You know, and COVID has, you know, constantly been teaching us, and often our predictions aren't quite on. So here you see, you know, IHME has been thinking that, you know, we won't see much of an increase in the near future, and I think their eye has been more on further down the road in the fall. And then, as you said, UW Virology thinking maybe there would be a wave in the spring. You know, both valid perspectives on information available at the current time. So I don't know that it's really a mixed message as much as, you know, complex information with a lot of uncertainty and people being transparent about what they think it means. So notwithstanding all that, our role as the local health department is to keep an eye on what's happening locally, statewide, nationwide, and around the world, and try to share that information with you so that your readers and listeners can be aware of what's going on as it's happening.
Any further questions?
Thank you all. We'll give it just a minute here to make sure that someone isn't still typing their question. Okay, seeing no further questions at this time, we will go ahead and wrap up with today's media availability. Please do watch for future updates and future media availabilities. We'll send those your way. See you soon.